Anyway, it's been really hard, so like we've gotta practice the Foley. The Foley goes in the belly button, right?
Yes.
Right? I don't know. Yeah, that's loud. Anyway, so I think what we're supposed to do is a silk sterile procedure. How does that work if it goes in the belly? Oh, hi.
You guys are nursing students?
Yeah, we're nursing students.
Great. Can you tell me if I have COVID?
Oh, we're not like nurses. We're not nurses, and we don't actually have the test here.
Oh, great. Thank you so much.
All right. Yeah, sure.
That's good. Yeah, reason for discussing is limit nursing care plan policy. So it's a new and fast process. And
yeah, that'll be good. You know, yeah, there's nursing care plans. We can't do any tests here, but I mean, if you do eventually go to like an urgent care, or if you go to the ER, they'll probably do a COVID test on you, chest X-ray, blood cell count, maybe an ABG just to look at your oxygen and carbon dioxide, and the CBC is just to see if you have an infection, and chest X-ray would be to see if you have like any issues within your lungs. So here, let me go get changed into something just a little more comfortable. All right, I'm just gonna ask you a few questions while Dao gets your vital signs. So first of all, how long have you been having these symptoms? What symptoms have you been having?
Well, I really can't taste anything, and I've lost my sense of smell. And it started about 3 days ago, and I went to this Mexican restaurant with my friends, and I noticed that I couldn't taste anything.
Okay, how long have these symptoms been going on?
About 3 days for that, and then the cough just started yesterday.
Okay, and then what about your vaccines? Have you had your COVID vaccine?
No.
Okay. Are you up to date on your other vaccines?
Yes.
And any allergies at all with food or medications?
Not that I know of.
What about any other like chronic illnesses?
I do have asthma.
Mm-hmm.
Does that mean anything?
It can. So there's very limited research, so it's a good thing we're actually discussing this, since there's such limited research on COVID and other involvements with other illnesses. But it can worsen the severity of the two, so it can cause asthma attacks and pneumonia, since asthma involves the airway being kind of constricted because of inflamed bronchi. So generally the recommendation is just you still follow the same precautions everyone else does, like the 6-foot distance. Also just having at least 30 days worth of your medications in case you need any of them, and avoiding certain triggers, which can include certain disinfectants. So if there's some that can trigger you, make sure someone else uses those disinfectants if you need to use that. What did you hear with the auscultations?
For the heart cell is normal, but for the lung cell, I hear the rattle and squeezing.
Yeah.
And for her vital sign, the temperature is 105. Your her heart rate is 110, and your blood cell is blood rate is 25. Oxygen is 92, and the blood pressure is 120/80.
Okay, so you do have a low grade fever since it's 100.5. 25 breaths per minute, that's a little high, but that's again because you were, I think, having some trouble breathing and the cough. Same with the high heart rate. And then same with the oxygenation as well. We like it more in the upper 90s, and you're at 92 right now. So we do recommend that you do go to an urgent care just to actually get that test done.
So nurse, what do I do?
Well, first of all, I'm going to tell you right now, you need to go to an actual urgent care so you can get tested, since like I said, we don't have tests here. But they'll probably at some point, if you go to the hospital, will give you something called remdesivir. It's a broad spectrum antiviral, and they give it to you via an IV.
And the nurse will check your renal and hepatic function for that too.
They might also give you heparin, which is another injection they'll give sub-Q, probably in your stomach, to decrease risk of clots.
And the nurse will watch for bleeding and obtain a APTT test for you too.
Yeah, and that APTT test just has to do with seeing if the blood's clotting. And then they might also, with the respiratory therapist, might have you use acetylcysteine, which will decrease the thickness of some of that mucus and will be given via inhalation.
And the nurse will have the instruction ready for us and displaying for the nursing intervention.
Yep.
For the nursing care plan, infective breathing pattern related to the possible COVID infection evident by cough, shortness of breath, dyspnea. Intervention for this diagnosis is have the patient sitting up like high position and drink enough fluids and administer Tylenol for the fever and refer the testing facility and deep breathing technique.
So since our patient is an asthmatic, we chose to focus our second nursing diagnosis on anxiety. Oftentimes, psychological manifestations can exacerbate symptoms of a condition, especially symptoms of a respiratory condition. So we chose to make a nursing diagnosis based on anxiety, and it is anxiety related to change in health status as evidenced by shortness of breath and restlessness. Some of the interventions we can implement to mitigate this are explaining every procedure very concisely and very clearly, and we can show them how to practice diaphragmatic breathing, which really does help with the airways. Another thing we can do is explain guided imagery and explain how to manage the stress. We can also provide a calm, quiet environment with music and dim lighting.
Hi, my name is Neha, and my nursing diagnosis for this patient is ineffective thermoregulation related to illness and infection, as evidenced by febrile body response. The goal for this patient is to maintain core body temperature within normal range. Some nursing interventions include monitoring skin color and temperature, administering antipyretic medications such as ibuprofen or acetaminophen as ordered, as well as administering antibiotics as ordered, administering fluid and electrolytes as appropriate to maintain the body temperature within normal range, assessing neurological status and noting orientation and level of consciousness for this patient, and lastly, maintaining bed rest for this patient to reduce metabolic demands.
All right, so our general outcomes, our desired outcomes are going to be that the patient should be able to clear the airway, and we'll know that they're able to because they'll have a normal respiratory rate. We won't hear any crackles, and they won't have shortness of breath. We also want to make sure that they don't go septic. So we would be able to know that they weren't septic, maybe based on looking out for septic shocks, so low blood pressure, high heart rate, maybe a fever, as well as certain blood tests such as a CBC. We also want to make sure as well that they don't get any pulmonary embolisms, which we could look for that based on the chest x-ray as well as breath sounds. Common complications associated with COVID-19 are respiratory failure, pulmonary embolism, sepsis, and acute kidney injury. And then ask for any evaluations throughout their stay at a hospital or just to check and see how they're doing. We'd continue doing that complete blood cell count. We would be checking vital signs. We'd evaluate for the symptoms of shock as mentioned, and we'd also continue doing auscultations among different interventions.